Theresa Dale, actually without her remembering it, was one of my early teachers in this country, like in the 1980s. I took some classes with her, and she was like a big, huge influence on me. Her thinking, her spirituality, her concern about the earth. And I've sort of been loosely following her since the grapevine. You know, once you connect with somebody, how you always hear about them at the most impossible places, lying on a beach somewhere in Africa or so. Oh, by the way, do you know Theresa Dale? And Theresa has been very active in the field and has been teaching groups of like-minded people her way of contributing to healing. And she started the International College of Naturopathy, which I'd love to find out more about. Like maybe at the end you can take a few minutes to introduce us to that, because I heard about the college for many years now, but don't really know what, how can I go there, get a degree, what can I do for me, what can I do for it, that kind of thing. And at the time, in the 80s, Theresa was still doing electroacupuncture. I don't know if she's still doing that now. Like most of us, like we've changed and graduated, and it's interesting. I just had breakfast with George, who many of you know, Gemstone George.
Oh, George is here.
Who I feel is a wonderful human being, and he, just like myself, sort of feels that we've graduated from the autonomic nervous system, and there's some higher systems that we need to learn to deal with. And I know people like Theresa, other people have been in tune with that somehow for a long time. Anyway, Theresa's going to give us a talk of the interrelationship of the teeth and the hormones and possible healing interventions that we need to consider. And I think that's all I want to say, Theresa, huh?
Thank you.
Thanks.
Thank you very much.
Yeah.
Thank you very much.
Is this your thing here?
Yes. No, it's somebody else's. But it's very nice, whoever's it was.
Anybody takes claim to the dental chart?
Somebody's maybe from last night, someone left it here.
Anybody hears about anyone missing this? I'm going to take charge of it because I need it.
Good morning, everyone. Good morning. It's wonderful to be here with you. And I want to start off just by introducing myself just for a few minutes and tell you a little bit about my journey in the health field. I started in this field at the age of 22 when I realized that I created a uterine tumor on top of my uterus. And I knew nothing about health. I had a terrible diet, smoked cigarettes, had a very difficult, like many of us, childhood. And I knew that I was really responsible for creating this tumor. And I didn't know if it was a fibroid or if it were cancerous, because the doctor did an x-ray, it showed up, and I decided, knowing nothing, and I often wonder how I did that, that I would just heal this thing by myself because I was sure that I created it. And the reason I was sure I created it is my mother had 9 surgeries, and she had a hysterectomy right after I was born. And so I felt like that genetic predisposition was passed on to me. And at 22, I was starting to exhibit symptoms of that. And I decided to change it, to fix it, and to do whatever I had to do to find it in my DNA and release it. And so my first experience was to find, for the first time in my life, a health food store in New York City, and to pick up a book by Paavo Arola called How to Get Well, and just follow the diets that he had in there. And I did, And I changed my thinking, I changed my diet, and within 6 months the tumor was gone on x-ray. And I'm now in my 50s, and it still isn't there, it still is gone, so I would presume that it's cured. And so if a 22-year-old who knows nothing about anything, really, I mean, can do this, I realize that anyone can do this if they have a couple of things. One is they have the intention, they have the motivation, they have the passion. That's one thing. And that they don't have any fear. Because if a doctor tells you something and you have fear about it, you feed the disease, you make it worse. And then you can make it grow. So at that point, at 22, I started exploring various aspects of health. And later on in life, when I was studying in Europe, naturopathic medicine and homeopathy, through a school here in the United States that is no longer in business. They're called Clayton University. They're a residential school that Lioness Pauling was the chairman of the board. I don't know, some of you may remember. And Clayton University had residential programs, but they allowed me to do mine in Germany and use a German mentor to facilitate all of my classes and have teachers sign off that I knew certain things. And my facilitator, you probably know, is Andreas Marx. Do you know Andreas? Well, he was my mentor during that time. And because I really felt that in the United States, you didn't learn true naturopathy. You learned it in Germany. And through studying in Germany with wonderful, wonderful doctors and teachers like Dr. Wolfgang Ludwig, Dr. Fritz Popp. Dr. Popp had a beautiful lab at the University of Kaiserslautern, and I probably just destroyed that word, but in West Germany. And at the time, which was West Germany. And so I had a wonderful opportunity. And I took all of my trainings and put them towards a naturopathic doctor degree. And then before that, I received a PhD in naturopathic sciences because the scientific aspect of naturopathy is so very important. So you know your facts, you know your chemistry, you know how things are developed and how the body works energetically. And so then, just very briefly, because there's just a little bit more to this story, when I was studying in Germany at the time when Chernobyl blew up, they didn't announce it for a couple of weeks because they didn't want to hurt the tourist trade in the south of France. And so I became deathly ill and didn't know why. My knees were swollen 2 to 3 times the size of them now, and I couldn't walk, and I had flu-like symptoms, and my hair started falling out, and I tested for radiation and didn't know where it was coming from, and then I finally found out, that Chernobyl blew up, and this was a devastating thing, that it was really not publicized here in the United States to the extent of reporting the effect that it had on people in Europe. So in order to get it out of my blood, out of my bone, out of my body, my liver, I used homeopathic remedies, 2 homeopathic remedies, cesium 5M and magentum 5M. Magentum is a color. And I also used crystals, not in a new age foo-foo way, and I just hate saying it that way, but Dr. Ludwig, Wolfgang Ludwig, I brought crystals to his home. He has a lab, or had a lab at his home. And they were crystals of all different sizes, and some were polished, and some were faceted, and some were right from the earth. And we measured them to see what it did and how it absorbed information. So I knew the size of the crystal I needed, and I put them under my knees at night when I went to bed. And in the morning when I woke up, they were normal size. So it was a real learning lesson for me. Unfortunately, in order to stay clean of radiation, because it was in the food and water in Europe, I had to move back to the United States so that I could be with you this morning. You see, that's the whole track of it. And so healing, when you can heal your own body, which I believe is a difficult thing to do, it makes it a lot easier to help other people, because you have an experience of what it's like to face critical situations and come through them with flying colors. Not that it's always easy, it takes a little time. So that's a little bit about me and my experiences in healing myself. And I wanted to present to you this morning my slides about endocrine healing, using the teeth like little organs to heal energetically, homeopathically, because as you well know, there are, most of our teeth have an energetic endocrine relationship. And I believe dentists are key in healing the endocrine system, that you have the ability to do this very easily. So I would like to move forward, but there's no signal. There we go. Uh-oh. Okay. So I have presented here, I've put together a flow chart of how we go about healing the endocrine system and using saliva testing and other types of testing to accurately diagnose what's happening to the patient's adrenal glands, cortisol levels, etc., meridians. So I always start with this. I invented the saliva test because the other ones that were available did not use the right times that would relate to meridians in the 5-element theory, which is the basis of all my work. I use the 5 elements for everything. So the saliva test brings us to creating a program for the patient using homeopathic formulas that I developed that are transdermal, contain no methyl polyparaben coloring, any kind of preservative other than a little bit of alcohol, and a pure liposomal cream. Using a cleansing and rebuilding diet, liver, gallbladder detox, because as you well know, the liver conjugates hormones, and if we don't address the liver in a patient's healing and detoxing, we're missing something there. Sauna, far infrared, or other saunas have been used throughout the world for years to detox. Also, we need to, most importantly, correct dental foci if there are any, and also correct electromagnetic field issues, treat scar tissue. We're going to talk about treating scar tissue related to teeth that have been pulled. There can be a scar that remains there, and how to work with that and treat that, as well as emotional and identity issues. So we have to look, first of all, at the actual causes of endocrine breakdown. First thing, of course, is lifestyle. Then we have stress. We have hormone levels. They change daily. In the morning, they're different than when we go to bed at night. And it's also, stress levels are related to how we handle and process stress. Diet, we see all the things that many of us already know. Even some people may be eating too many carbs in their diet, and this can create too many sugars in the body if that individual if that's not right for that individual. And then we're looking at HRT. Any hormones put on or in the body, whether they're natural or not, have a significant negative impact that I have absolute proof of in that 1,000 people before and after test results. So you're going to have an opportunity to look at those actual tests. And then, of course, the dental relationship to hormonal issues. Every tooth has an endocrine relationship. Dental material that's not biocompatible can be the source of hormonal issues. It could be the only source of hormonal issues, too. Drugs absolutely devastate the adrenal glands. And genetic has an influence as well. Scar tissue that goes over a meridian will block the flow of the meridian. We have to look at that. Adrenal exhaustion, environmental exposure to pesticides, radiation, mercury, lead, toxin, or negative people. I've had patients who have had a lot of stress because of their relationship and negative influences. So we need to look at that in many different aspects. Emotional, resisted emotions, denial can exhaust the adrenal gland. Holding on to things, not communicating them, can make you sick. Okay? And then we have electromagnetic fields or geopathic disturbances that I work with so extensively in Europe, and I can just give you a very little memory that I have of Dr. Ludwig and his wife Gisela and I out in the Black Forest testing trees, you know, doing dowsing on trees to find the yin trees, the yang trees, and to find the geopathic disturbances. I mean, it's very interesting when you actually see that these things are real. It's like my philosophy is prove it to me, you know, and so that's what I expect to see is you know, let me see for myself, because there's a lot of information that's available for you to read and digest, but how much of that information is usable, really works, and is really effective. So the first step in endocrine healing in a dental practice is to educate the patient. And you know, I'm not telling you anything you don't know, that's why you're here, but sometimes it's always a little bit helpful to learn another way to do it. Videotaping for an office waiting room, or is some of my doctors that consult with me actually have an educational room where they show their patients videos before they sit in their chair. So it saves them talking to them, repeating the same thing over and over again. And patients always learn well from videos. Educational handouts, including tooth charts, neuroemotional remedy surveys, so they can, the patient can write down their own emotional components. Now, there is a neuroemotional remedy survey in your handouts that were in the back of the room. If you walked in, you received one of those, and you'll see how easy it is for a patient to know exactly what emotions are out of balance in their body and what meridian it's related to. So to offer this information is very important. And of course, you know to take a complete medical history, not just to find out how their teeth are, but also do they have any liver organ-related health issue problems. Then the next thing would be to locate the tooth, the gum area connected with the patient's symptoms that you see on their neuroemotional remedy survey, that you have an opportunity to see in their medical history that they fill out, to locate the teeth that are related to that and make a note of them, and then to test the patient using one or more of the following modalities. You can use the saliva test, which has 6 cortisol levels. It has the advanced test has melatonin and a thyroid-stimulating hormone. progesterone, testosterone, DHEA, estradiol, and 6 cortisol levels, like I said, 1 for every element in the 5-element theory, and an extra one because the fire element is so big. It has so many, you're going to see how many organs are in the fire element. This is so easy to adapt into your practice. Again, we can use electrodiagnosis to determine the tooth and the gum area. We can use, it's also called transdermal screening. And then Vega can also possibly indicate meridian imbalances, and there's a new Vega piece of equipment that can just direct you to see if your focal disturbance is in your head, which is the probability is it's in your mouth. So, and then the last one is a system that I developed called neurophysical reprogramming, which easily allows you to locate the stressed dental, TMJ, and all other organ, gland, meridian relationships. And we'll talk about that more later. Now, if you're testing a meridian, it's important to note that both degeneration and inflammation of meridians are indicators of a stressed dental situation. So if someone is using EAV, it's important to note, whether it's degenerative, low, or inflamed, high, they can be both indicative. And we have to find the teeth involving, the actual teeth involving the patient's problems, their physical health problems, and also their emotional health problems. So the third thing is to test every tooth. If you're using neurophysical reprogramming, which is a very accurate form of kinesiology that we'll go through, you want to test every tooth on the top. If it's a natural tooth, even if it's a crown, you want to see the top. You want to test the crown of it. You want to test the side and the gum to determine if the root and the entire tooth can be regenerated. How about regenerating the teeth so we don't need root canals? What about that idea? Okay, so we can regenerate it using homeopathy, and I'll tell you how homeopathy works well for doing this and the rate of effectiveness that we can get through this. And then we have to find the correct homeopathic nosode and the neuroemotional remedy, meridian, and drainage remedy. Now, the thing about there's a whole thing about how to use homeopathy injected in the gum of the tooth where there's a foci, and maybe you need more than one homeopathic remedy injected, and how to test it using homeopathic filters so that the testing is accurate. Also, we want to test biocompatible dental materials with blood testing, which is available through a couple of companies that can do blood testing. And then you can actually take the blood test and refine the choices using neurophysical reprogramming for the optimum substance. Because when you get a blood test, you get a number of ones that are the least reactive, but you have a lot to choose from. You can actually take that and refine it down to the optimum, the priority, the best one. That's what we're looking for. We also want to see if amalgam is present and the source of the problem. We want to administer nutritional programs according to testing. You can do this yourself, or you can have someone that works with you in your office to assist you. And if you do the saliva test, then the nutritional program comes with it, because every saliva test that is done, I personally do the program for every patient, and I work out the detox program based on the results and on the health profile survey that the patient fills out for me. Your patient would fill out for me, for us. And then we would inject the homeopathic nosode, or more than one, into the gum of the tooth. This may require a few office visits. Sometimes I've sent a patient to a dentist and it required one time to fix a serious problem with their tooth. Okay, so it can require using more than one nosode. And the key is you can't use procaine with a homeopathic remedy or anything else. It has to be done separately by itself because it's energetic, and the procaine is so strong it may knock it out so that it neutralizes it. After the first injection, the patient must have an oral drainage remedy to prevent severe aggravation and to help detoxification. The patient usually takes a drainage remedy for the next week or two. You can also test the frequency of that with neurophysical reprogramming. The last and most important step, for many dentists that do root canals, if you had statistics after the fact, after the root canal was done, and believe me, I'm not advocating root canals, but let's say that after 6 months, 3 months, a year, a survey, a medical history was sent to the patient for them to fill out all of their health issues. You could look at it and you could see if any one of those health issues and organ issues related to the root canal that was done on the patient. That's what we call statistics. And I think really we need to do things like that to find out down the road, what is the result of the work that was done on the patient's teeth. And I see this not as a dentist. I'm just a lowly naturopath, but I see it as being very important. Now what we're going to be looking for here is problems with dental work that was performed by an associate, or just by an incompatibility that the patient has to something, problems with the organs and meridians related to the tooth that was dealt with or that was treated. Now, furthermore, pathology in an organ can create a diseased, inflamed tooth as well, so it can go the other way around. I've had patients with hepatitis and then their liver tooth started hurting, their canine teeth, their gallbladder liver teeth. So using biocompatible substances for all dental work is crucial. Adrenal cortisol levels and all hormones can be affected negatively by poor dental health, periodontal disease, dental work, incompatible dental substances. That can cause tremendous stress on the adrenal glands. Likewise, cortisol levels and hormones can be helped by conscious dental treatment. Now, there's this big root canal controversy, isn't there? I mean, let's face it, during this meeting, I've heard some people say it's okay to do it if you use biocalyx. It's okay, to test it and see if this is what the patient needs, and here's what my own experience is that if there's a chance that a root canal can go awry 10 years down the road, 5 years down the road, why do it? If there's a chance that in some way it can hurt the patient, I don't see why we would want to do that, unless some of us are absolutely positive that it will never cause a problem, ever. So my idea is just to be very aware of the idea of root canals, also not to be pulling teeth, not to be just pulling teeth. I know people who have had a lot of teeth missing just because it was a fine, healthy tooth, and there was no symptoms, but because someone said, you need to pull the tooth because energetically I tested that you need to pull the tooth, then I don't think that is the best way to go. On the other hand, if the tooth has just a little bit of life left in it, why don't we try injecting the right homeopathic remedy in it to see if we can't revive it completely before anything is done? So basically, teeth should not be pulled out unless assessment of choices are made. And then whenever we have a tooth pulled, of course there's scar tissue there. This is what acupuncturists and what you learn in Chinese medicine, that if you pull a tooth, there's a little scar tissue there. I've heard acupuncturists and OMDs tell me that a person can get a heart attack from having or a stroke from having a tooth pulled. And this is due to the scar tissue. The scar tissue can be eliminated using bioresonance therapy and working with procaine. A diseased tooth has pathological information which can circulate throughout the meridian, and bioresonance therapy can correct the scar tissue. So I have a little program, and it starts with the saliva test, and the saliva test shows a lot of information about the patient's stress levels and their meridian health. And what you get with the program is comprehensive therapeutic recommendations, homeopathic hormone rejuvenation system. And we also find out adrenal stress indicators, which there are 4 of. And I'm going to show you what those 4 adrenal stress indicators are. You also have them in your handouts. You're going to get, the patient's going to get an endocrine rebuilding diet and nutritional recommendations, and a resource list where the doctor can find everything that I mention. Here is a toxicity report, which I feel is so very important, and you may not hear from anyone else, but I have done and worked with now over 1,000 patients, doctors' patients, and my patients, but mostly doctors' patients that consult with me. Their saliva tests before and after, and then a second after. So I have a before using program to find out what they've been using on their body in their handwriting. And we have revealed that 97% of women and men, but to a lesser degree, using natural and or compounded progesterone or estrogens from wild yam, soy, what are so-called natural, have toxic levels of hormones. Could be 60 times normal. And we're going to see that. I'm going to show it to you. And I have a few with me, but you're always welcome to come to my office and see 1,000 of them. It also reveals that there are stressed adrenal cortisol levels from using these so-called natural creams, and abnormal hormone ratios. Ratios are very important between progesterone, estradiol, testosterone, and DHEA. And then they have symptomology from using it. We've also just determined that the HRT users, whether it's synthetic or natural, need a liver-kidney detox because the excess hormones actually store in the liver and the kidneys. And they're creating a burden on the immune system. 70% or more reveal women on synthetic HRT estrogen have abnormal hormone ratios, including cortisol, and are estrogen dominant if they're taking an estrogen substance. And they exhibit symptomology, severe symptomology. At least 75% of women using HRT synthetic progesterone and estrogen have abnormal hormone ratios, estrogen dominance, and toxicity, and 100% of them on synthetic hormones risk cancer. So here are the actual symptoms. If they're on a natural progesterone cream, then they would have weight gain, hair loss, loss of libido, depression, adrenal stress. There's other potential risks, risk of cancer, endocrine dysfunction. And in order to get these ratios down, let me give you a little example. So let's say a menstruating woman, her progesterone level in the follicular phase of her cycle, which is the beginning phase of her cycle, should be maybe 110 to 120, maybe a little bit more depending upon the age of the woman. If they're on a progesterone cream, it can go to 6,500, 7,000. This is what made me realize that I needed to do something about this, because this is very common. And without using a homeopathic remedy, it can actually take 6 months to a year to make that come down. It comes down very slowly because the toxin and the residual from the hormones actually are stored in the liver, and the kidneys have to filter it out. But with the new femme, we're talking about 2 or 6 months to get it out of there. That's the first thing, to detox it out. Estrogen toxicity symptoms, breast lumps, uterus problems. We know there's cancer, risk of cancer, ovarian problems, tumors, fibroids, depression, severe depression, I might add. Weight gain, excessive facial hair, gallstone risk of heart attacks, strokes, adrenal stress. With new femme, if they're very estrogen dominant, it could take from 2 to 12 months. Most people around 3 months to detoxify. Without new femme, there's been a few that it's taken, with new femme, there's been a few that has taken around 11 to 12 months. With new femme. Without the homeopathic products, we're talking about 8 months to 3 years to correct it. First thing is to know what we're dealing with. Some more statistics from the Digestive Disease Week, San Francisco, May 23rd, 2002. Estrogen is linked to gallstone risk. Gallstone can develop when bile, cholesterol, calcium salts, and other substances come together to form a mass in the gallbladder, the tiny sac tucked under the liver that stores bile. Researchers studied more than 13,000 middle-aged women who enrolled in the European Perspective Investigation into Cancer in 1993. The investigators followed up on the women an average of 3 years later and found that 58 of those women had developed gallstones. And so that's what they feel that is part of the studies. Now, before and after test results reveal that synthetic, natural, and bioidentical compounded hormones cause the body to shut down its production of its own natural hormones. Why? Because it gets lazy. It gets dependent on putting hormone creams on taking hormones. There's a dependency that's created. It's a toxic burden to the entire body, including the liver, the kidneys, the blood, and the immune system. It creates extreme toxicity of hormones, and it causes elevated levels of hormones and extreme cortisol problems and adrenal stress. Since there are many causes of endocrine breakdown, using hormones will actually cover up the cause or camouflage the underlying cause of the problem. Okay, maybe they're having hormonal symptoms and the problem is their tooth. So what do? You ignore, most doctors ignore the tooth because they're not dentists, okay? And they treat the hormone problems when what they need to do is come to see you so that you can see the cause where this, or they need to be trained in NPR so they can find it for the dentist. So, and these problems can be life-threatening. If a person has extreme liver stress, it can push someone into menopausal symptoms. If they have extreme blood sugar problems, it can push them into seemingly hormonal symptoms. A root canal, I have found on a lot of patients, can do the same thing depending upon the tooth that it's in. So hormone ratios, I think, are pretty exciting when you take a look at it. traditional hormone ratios place women in categories which may falsely indicate pre- or post-menopausal conditions. We want to let the body do what it does naturally. We don't want to force it. And these guidelines that we have from saliva testing and from blood testing that put women and men into a box and say, if you're 40, okay, and your hormone levels are between, say, 95 and 150, then they're going to say, okay, well, you're in menopause. When in actuality, they might be under extreme adrenal stress, and if they're just detoxed and fed the right nutrition, their teeth are looked at, then within 3 months, that whole reference range will change. But if they're treated allopathically, using a hormone, using a drug, using a natural progesterone cream, you're never going to get to the problem of why that person is like that, why they're having those symptoms. So the homeopathic products will give the body the correct information, the correct electromagnetic signals to go where they need to go, causing the body to create its own hormones and healthy hormone ratios. It knows how to do that. We just need to remind it. Hormone ratios depend on the following factors. We have to look at cortisol levels, biological age, hysterectomy, whether there is a hysterectomy, whether it's partial, tubal, chronological age, hormone usage, medications, drugs, and symptoms. And also, when we're looking at these, we first and foremost, we want to check the root, any root canals or any diseases in the teeth. Even periodontal problems can cause hormonal problems. So we want to look a little bit at the body clock. This can help us in diagnosing the problem. I found this an extreme key to treating, to diagnosing patients. And I use it in my saliva test. This is how my saliva test works. What I've done for you is I've created the teeth related to the elements and to the times, okay, of the day. So if you're going to work with the body, to heal the body, these particular times are important to test when you're doing saliva testing. So these are the cortisol testing times and the adrenal function testing times. All 5 elements are tested. And the fire is twice because there are so many, it's such a big element. It has the entire endocrine system, it has the small intestines, the thyroid, the adrenals, the heart. And so it was necessary for me to put in 3 fire element times. And the sex circulation, of course, which is the endocrine system. So for you, I have correlated the teeth. And this is what I teach in the neurophysical reprogramming training, how to test these things if you're going to do kinesiology. 8 a.m. is the stomach time, noon is the heart time, 4 p.m. is the bladder time, 8 p.m. is sex circulation, and within that time you can get a good reading on thyroid as well. 2 a.m., I invented this time for the saliva testing because no one put that time in because they didn't want patients to wake up at 2 in the morning, but being that I'm a sadistic person, I told my patients, just set your alarm and do it for once in your life. It's just communication. Once in your life, get up at 2 in the morning. And so that's what doctors do. And this way I can see the liver relationship, which is crucial. And then we have the 4 a.m., the lungs colon. We can also look at colon this way. If 4 a.m. is off, and if their lungs are off, this means they have grief in their life or grief that's unresolved, and there's always a colon relationship that we need to look at. So you can see the tooth numbers on the right side. You have this chart in your handouts, and this is all tested in the saliva test.
So what are you saying about the peak times a day?
Those are the times of the day, and we're going to look at that right now. This is going to answer that question. It's a good question. Okay, so if you look at 8 o'clock in the morning, we see it's earth and it's stomach time. So if you have a tooth that's on the earth meridian, and the person, it's a very severe problem, if you can arrange it to have them take a remedy at that time when they are at home, that would be great. That would be the best, because that's when their stomach is most receptive. If you have an opportunity when they're in your office to give them a homeopathic injection into the tooth, into the stomach tooth, if there's this problem with the stomach tooth, that would be great. You would see awesome success.
Would you anticipate that you're going to get a different cortisol reading, at that time of the day, if that tooth has a root canal in it?
Yes. Also, you can see, you can use, yes, absolutely. You can also see that if a person has mercury toxicity, and you can check their cortisol levels and their meridians before mercury removal and again after mercury removal. You can do that as well if you'd like to do that, if that fits. Yes, sir?
Would it also tell you what would be the ideal time of the day to remove that mercury?
You could use that as a guide to remove it if you chose to, being that the teeth would be most sensitive at a certain time, like the stomach tooth is most sensitive at 8 in the morning, so that would be a possibility of doing that. I am most concerned with treating the teeth and how they're treated, although I understand it's very hard to have your patients come in at 2 a.m. to give an injection at the liver time. I mean, I do know that. However, I want to give you the whole story because you're all individuals and you have choices, and you can use to choose to use this in any way that you'd like to. Okay? Now, for saliva testing, this body clock is essential, because if I'm going to do a program on every patient, which is what I do, then I need to have people spit at the right time. And I have incredible compliance from the doctors and their patients. And many of the doctors want me to talk to their patients. I don't like to do that because it's enormous amount of time. I would prefer to train the doctor or the doctor's assistant and have it happen that way, but I always support the doctors, and if you have a question or a patient has a question, just tell them to call me, because it's usually very quick and I can get them very motivated. No, they don't call me at 2 in the morning. I mean, that's a very innovative idea, but it's not a good idea. Okay? And we want to look at the energetic relationship. Using homeopathic filters for accuracy. Oh, I think I missed something. That's okay. Using neurophysical reprogramming with homeopathic filters for testing makes the testing really accurate. It's reproducible. The problem with testing using kinesiology, okay, if you were to do the testing in your office instead, let's say, of doing saliva testing, you need to use homeopathic filters so that you don't make a mistake. Not that you're, fallible by any means, but let's say that anybody could make a mistake, all right? Now, in my school, the International College of Naturopathy, I train licensed health practitioners, and we bring in a bunch of patients in our lab, and I'm a very tricky teacher. I bring in my Staufen nosodes, which are in German, and I have them all test the same patients. None of them can understand what the remedies say. And I can tell you that my test is, I would say the last class that we did, we probably had about 95% reproducibility, meaning that all of the students being novices at this, got 95% success in coming up with the same thing on every patient without even knowing what they were testing. And that's why I did it that way. Because the worst thing that I can think of is to, it's like, you know what I'm talking about. Anyway, we don't need to go there. Using homeopathic filters for accuracy, you can independently test to determine a causal relationship to any disease. The gum, the crown, the natural tooth, the appliances that they're wearing. Braces cause a lot of problems with people because their cranium changes, you know that. And they may need to get cranial sacral work. They may be allergic to stainless steel. The rubber bands in their mouth. Everybody is so biochemically individual. And of course, the amalgam fillings. And we can also test root canals using Staufin remedies as a diagnostic tool to therapy localize on the tooth. Therapy localization is a very easy technique to learn. And we can just test the right Staufin homeopathic nosodes on the teeth and find out what to inject into the tooth to heal it. You are healers. That's the way I see it. Even if you don't agree with me, I see you as healers. Therefore, when we look at teeth, I would like to approach this as you are being more than capable of healing teeth. Here is the A-tooth chart. People have different versions of it. Dr. Rao has a very expanded tooth chart, which can't fit on here. And I love it because he has the stomach meridian going right, it goes right over the nipple, and so if a woman has breast cancer, you want to test the stomach tooth to see if there's a root canal in it. Very important. And I do work a lot with a lot of breast cancer patients through my doctors who protect me. Endocrine rebuilding nutrition. These are the things that I have found to be effective. You may have your own things, but I just would like to give you some of this information. According to saliva tests, if there's a hormonal situation, I always like to recommend essential fatty acids because they can help the symptoms, not the cause, but the symptoms, alleviate hot flashes, cold sweats, PMS, weight gain. And there are problems associated with fat-free diets in and of itself that can cause the problem in people not having enough essential fatty acids. Probiotics are very important, and I use a company called Pharmax for my probiotics, and I like their products very much. They test very good because probiotics can protect against infection, enhance nutrient absorption, detoxify the body. Probiotics are very good when anyone has a dental infection or anything going on in their mouth. It's very, very helpful. So EFAs, you can see there's GLAs, there are DHAs, EPAs, omega-3s. There's different varieties of those that are recommended according to the results, and digestive enzymes actually can decrease food allergy responses, which I believe food allergies are just a symptom. I do not believe food allergies are a cause. I have never been convinced of that. Food allergies are a result of a burdened immune system, and that, I think, is the bottom line. Stabilize chronic bowel conditions and digestive wellness. So vitamins and minerals, of course, are so important for toxicity, synergistic functions, natural versus synthetic. Always natural food-based vitamins and minerals are best. Even though they're in smaller quantities, they're probably absorbed better. There's a substance I like very much that has an enormous amount of vitamins and minerals in it. It's called E3 Live. It's a live blue-green algae. It's frozen. It's sent to you frozen. As it defrosts, you take it. It is really amazing for energy, vitality. I usually take it every day, and I have usually put my patients on it. Yes, that's all available. And I don't have that phone number with me, but if you call my office, my assistant Mara will give it to you. And they have assays done from every group that they get every time they harvest. They have assays done. That was the first thing I asked. E3 Live. I've never ever liked blue-green algae in my life because none of it ever tested good. This is the first thing I've ever found that tested good. Now, it's testing good now. Do I know in 6 months, is it going to test good? I have no idea until 6 months come. But every batch that comes in, I personally test and I get an assay on. Antioxidants. Neutralize cell damage, bolster immune system, and enhance mitochondrial energy production. So we want to use antioxidants. Liver decongestion is so very important, and I cannot emphasize that more, because if the liver is not conjugating hormones, you are treating the wrong thing. You have to look at the liver, gallbladder, tooth to see how that's functioning. And sometimes I send patients to a dentist to check their liver, gallbladder, tooth because they have chronic liver problems, and that's what's causing their hot flashes. And the dentist finds that there's a problem with the tooth, and we do an injection or two, and there's hot flashes go away, and I haven't even done a saliva test on them, you see? So through NPR, you can see these things. And I have created a gallbladder liver flush kit that incorporates herbs and my homeopathic remedies, neuroemotional remedies, which are meridian remedies, and they are taken separately at different times in the herbs. And this dissolves gallstones, dissolves kidney stones very gently. It's an 11-day detox. And I put it together because I was tired of telling people to go to the health food store and get this, 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 and this. And then they would get all the wrong things, and then I would have to spend more time with them just to clarify and answer their phone calls. So I created this so that they have what they need. And then CoQ10 for heart health, intestinal purification also. Endocrine rebuilding diet is very important, including raw live foods, organic foods, low carbohydrates for some people that need that, organic proteins. If they're going to eat meat, make sure it's organic. Live green veggie juices, wheatgrass juice. I love wheatgrass juice. And then eliminate these particular foods, which I'm sure you're already aware of. Too many cooked foods. Cooked foods are decomposed foods, so you have to make sure there's live foods in the diet. Cortisol levels and related specimen testing times are related to organ, gland, and meridian function. My homeopathic remedies balance all of the above, including emotional components. The hypothalamus, pituitary, thyroid, and adrenals must be re-educated, detoxified, and rejuvenated. So we can do that with my homeopathic formulas. Do a saliva test. We put them on the formulas. They retest in 3 to 6 months. Meantime, you could be checking out, all of their teeth, and we could be a great team. We have 1,000, as I said, saliva tests before and after. Most of them have a second after and a third after, because it's important for me to see what the body does down the road. Indicating toxic levels of hormones from using natural and synthetic hormone replacement. Homeopathy is not hormone replacement, it's hormone rejuvenation.
You're not wild about melatonin.
It's a hormone. The body will make its own melatonin. It'll make it from using homeopathy, and I absolutely guarantee it. I have 1,000 tests to prove it. I don't take melatonin. I never recommend it to patients because it fries the adrenal gland. It gets lazy. Like we were saying, hormones make your glands and organs lazy so that it has no reason. Why should it make its own? You're giving it more than what it's supposed to do. So the whole idea is to re-educate it and heal it, heal the pineal gland. So the clinical studies show that this is very, very interesting. This really, I have a lot of passion because of information that I discovered through doing saliva testing, that elevated cortisol levels, if there's one cortisol level that's elevated, it indicates low blood sugar. If there's more than one, in every single patient where there's been more than one elevated cortisol level, through checking with their doctor and their family history, they have a predisposition to diabetes or they have existing diabetes. Please make a note of that, because it's very, very important that we know that cortisol levels, if they're high, it's just not they're high, it means something. And there was a patient who they didn't put their weight on their health profile survey, but a doctor in Florida sent the saliva test in, and this patient didn't write down that they had anything wrong with their blood sugar. It was a male, and you know, not all men, but some men, they just write down their name, address, their male, and they have a prostate. And that's all you find out. You know what I'm saying? That's it. And so in doing this test, this person had 4 out of 6 high cortisol levels. So I went, whoa. I called the doctor. I said, look, I have to tell you, this is what's coming up on the patient. Now, this to me would signify that they have diabetes, but I need you to tell me if I'm accurate or not. And she said, he's 402 pounds, and he has he's on an insulin pump. That's how I found out about these statistics, by doing the phone calls, doing the history, and tracking the patient, and finding out what's going on with them.
What do you know when they're all depressed?
When they're all depressed, then we know that it's stress, it's a tooth, it's the diet, it's the way they are handling their life with their relationships, their genetic predisposition or blueprint for emotional programming. So it could be all of those. It could be that they're on HRT. Melatonin will cause suppressed cortisol levels. Any hormones, any drugs will and can not always suppress all of them, but suppress at least one of them. At least one of them. It's a drug. Your body doesn't want that. So, determination of any of these depend on the actual level of elevation. In that, we tested nanograms, and the higher the level, the more likely blood sugar problems and diabetes is present or genetic. Yes, sir.
Besides pharmaceutical drugs, taking supplements that are toxic and full of all kinds of junk, would that also suppress the adrenal?
Yes, all drugs. All drugs. No matter what kind of drug. An antibiotic can do it. All drugs. You know, I mean, if you took a little baby aspirin, I'm not saying that, okay? I'm saying that if a person is on a prescription drug, I'm going to give you a case history. I'll try to make this really short, but it's a great one because it's a patient. I don't see many patients these days, although I love it. I only work with critically ill people because, kind of spirit guides me on what cases to take. And this parents called me with a 7-year-old child that has been in treatment by medical doctors since she was 1.5 from hemorrhaging bowels, blood in her bowels, since she was 1.5 and she was 7. And they had her on prednisone and another drug which escapes me right now, but it's a very serious drug, and they diagnosed her with having diverticulitis at 7 years old. And So in this situation, they were feeding her, she went to a nutritionist, they were feeding the child meat, they were feeding the child cheese, mucus-producing things. No one ever did a blood test other than a CBC. No one did a Chem 24. When I had her CBC done, her monocytes were high, which indicates parasites. No one ever mentioned parasites. She had a blood transfusion. They gave her blood transfusion. No one ever offered her iron. If you can imagine, her leg was swollen up to the knee, black and blue from infection. Okay, and they had her on antibiotic too. So when they found me through the email, when they emailed me, I got an immediate hit that since they lived in LA and since they were right here and since they were emailing me that I should take this case. She tested for so many different kinds of parasites I can't even tell you. And she had mucus in her stools in 5 days using homeopathy, no herbs, homeopathy, cold and castor oil compresses on her legs, and homeopathic remedies, and changing her diet. The fever was gone. She was having 9 bowel movements a day. Her teeth were fine, but she's having 9 bowel movements a day. And then she got down to 2 or 3, which is normal for a child, good working intestines. And the blood just comes out very, very little with the parasites. And she's on iron, she's on all the right things. And in 5 days, it's been almost a complete turnaround where her leg is completely normal, not swollen, not black and blue, and she's able to walk on it. She wasn't able to walk. So I'm saying, if you test accurately and you've got the right remedies, homeopathy will cure anything, and I mean anything, and including working on your emotional issues.
So how about xenobiotics, which are estrogenic? Your program is really focused toward HRT, but what about those low-dose, very toxic estrogens from environmental?
Well, those can be detoxed very easily through the program that I have. Yeah. Oh, it handles all of the organs and glands, because remember, homeopathy is like a signal. We're going to learn more about that. We're going to try to move along. But this is the first saliva test I'm going to show you. And this is a female, aged 36 years old. Her husband's a chiropractor, and he was treating her along with his friend. And they had her on, in her handwriting, you will see, she's on a natural progesterone cream. Her level, she has infertility, so they started her on a progesterone cream. Her level in a follicular phase should be 120 to 130, okay, to a 2.0 to 2.5 estradiol. Her progesterone is 6,650, and what it did was it suppressed her estradiol level to 0.9. It pushed it down. Now, this is not okay. This is what natural hormones do. Now, look at her, in her cortisol levels, she has 2 cortisol levels, her stomach and her heart meridian. Her DHEA is low normal. And her estradiol, I mean, she's never going to get pregnant with an estradiol of 0.9. I don't care how much progesterone cream you put on her body. It's not going to happen. Okay, so what I did was I recommended the NewFem program to her to stimulate suppressed estradiol levels, to make the normal amount, to work with the adrenal cortisol levels, the neuroemotional remedies for the stomach, the heart, the thyroid, adrenal, and the female endocrine system. This is what the doctor gets back, along with 5 pages of diet and nutritional recommendations.
15 minutes.
Okay, thank you. I'm going to have to, hurry. Okay, so... Rock and roll, baby. Okay, so in her writing, you can see where she writes, what she's using here, natural progesterone cream. This is filled out by the patient. This is the after test. Her after test, her progesterone, we detoxed it. It's a little bit too low. It should be higher, but at least we got this out in about 3 to 4 months. And her estradiol has come up quite a bit to 1.6. So we have a big change here, and this is the second recommendations. This is a medical doctor in North Carolina. That's one of my biggest clients. And she's menstruating, and her progesterone's 22.3. Estradiol is 1.6. She's estrogen dominant. She has very, very little progesterone. And look at her job being a doctor. Look at all of her cortisol levels are at about 5 out of 6. And her liver 2 a.m. She has extremely high liver toxicity. Okay, and this is what I recommended to her to fix it. It's a new FEM program. And this is her after 4 months. Progesterone is 103.0. This is using homeopathy, no hormones. And estradiol is 2.4. She had normal menstrual cycles. Before, she was in constant stress and having severe symptomology. This is a woman with a complete hysterectomy. Progesterone on, estrogen patch. She was told she needed in order to make all of her hormones, because she was told she doesn't make hormones anymore. So progesterone is 94.4, which is maybe a little bit high for a woman with a complete hysterectomy. Her estradiol is too high for 94.0. It's 2.5. Abnormal ratio. DHEA is abnormal because of the patch. Cortisols too are abnormal. And I made recommendations to her. And then the after test is all of her cortisols are balanced without using any hormones. She was making, after 4 months, she was making the correct amount of progesterone, 86.3, which was very good for her. And it was good for her because you can see all of her cortisol levels are balanced. And her estradiol was moving around a little bit, was very slightly elevated. And but sometimes you see those very slight. I would like to see it a little bit lower. But she felt really good, really good. And her adrenal glands are making its own hormones because that's what they do. So the Meridian remedies balance dental problems, and this is part of the new FEM, but you can also use them by themselves. There's 13 remedies. Each one is connected to a different meridian, one for every meridian, one extra one because we have boys and girls. And they're deep, quick relief. They're high-potency homeopathic remedies with low-potency drainage remedies so that there's no aggravation or worsening of the situation. It releases repressed emotional imprints and beliefs causing disease. There's no side effects. The patients continue therapy at home. They're high potency, as I said, and based on traditional Chinese medicine and 5-element theory, they balance and detoxify acupuncture meridians, dental issues. There's one remedy for every meridian, so every remedy will be related to a tooth. The dosage depends on testing, or you could do 5 drops twice a day for a week to a month, depending upon the person, age 7 to 12, 2 drops orally daily. I developed these in 1990, by the way, and they have wonderful success. And we have a neuroemotional remedy survey, which we have a copy of, and neuroemotional remedies are used for the following things. For all of these things, which you have in your handout. So I'm not going to go over that. And this is how one can use it if they are emotionally depressed. They just pick out the remedy. Let's say they're really angry. They pick out the liver remedy, and they continue to feel really angry while they take the remedy. And what happens is the anger goes away, and it's hard for them to even find it because the neuroemotional remedies have very high potencies of homeopathic remedies, so they go very deep, but the drainage remedy in there prevents a severe aggravation. Kirlian photography before and after, using neurophysical reprogramming and neuroemotional remedies. This is an AIDS patient before. And you can see the breakage in the meridians. Okay, this is the left and right hand. You can see the breakage. And then after, this is using a very good Kirlian camera. 30 minutes after, this is what their energy looked like. After doing neurophysical reprogramming, which I'm going to share with you what that is. It's a process you do with the patient that incorporates testing, including homeopathic filters, to filter out mistakes and to find the cause or the seat or the anchor of the disease, the very base of the disease. So with neurophysical reprogramming, which is what Dr. Klinghardt said for me to talk about just for a moment, because it's what I teach in the International College of Naturopathy, there's proven accuracy, method of diagnosis and healing disease, reproducible results. We use the 5-element protocol. We learn reflex points. You can use the testing for nutrition, for the teeth, to test the right homeopathic remedies. We use my homeopathic filters that I developed, which there are 12 of. We filter out testing errors, mental interference, because when you do testing on a patient, if you use kinesiology, I can guarantee you that your mind will affect the testing. You have to learn to become neutral. There's a certain protocol, and to use the filters. You're going to learn to it'll indicate genetic or environmental causes. Environmental can even be from the innate, outside the cell, to the brain, to the spinal. Elimination of causal core identities, resisted emotions. You're going to learn about neuroemotional remedies to drain and detox causal energy patterns, DNA testing, limbic brain, old illnesses, behavioral patterns are released, sometimes in one session. Okay, we're going to very briefly go through this. The new Fem, I think you've learned most about that already, that the formulas are homeopathic, and you can use them for menopause, endocrine breakdown, for the teeth, for psychological changes, weight gain, hot flashes. And this talks about the different hormones, which I think you have in your handouts. Hypothyroid and hyperthyroid, two very important things, because the symptoms are different. They're two completely different problems that need to be dealt with individually, because they're totally different, and totally different picture to the patient as well. So testosterone, as you fellows know, and what women don't know, it's important for you as well. Some women who are very aggressive may be too young and have too much testosterone. I never recommend using hormones. We can do the same thing with my homeopathic formulas. You can even use individual homeopathic remedies if you just want to buy homeopathic testosterone. In a 6C or 12C or 30C, you can also get good results that way. Some very important things about homeopathy, when it was founded in 1500 by Paracelsus and then just rediscovered in a way by Dr. Samuel Hahnemann. And I want to try to get through this. I think the most important... 5 minutes. Okay, all right. A homeopathic remedy contains the memory and the imprint of the original substance used, so that it is a truly healing substance. But the whole thing is finding the right potency and the right remedy. You can have the right remedy and the wrong potency. You have to test both. Homeopathic medicine is made from botanicals, minerals, chemicals, radiation, poisons, animal organs and glands, bacteria, viruses, and disease. When people say, are there any animal products in homeopathy? I'll say, well, the origination of homeopathy is the worst poisons, the worst things you could ever think of, because it works according to the principle of like cures like. Homeopathy, you can use homeopathic no-sodes or sarcodes. Sarcodes are made from healthy tissue and organ secretions of the body. They stimulate a healing response in the targeted organ, and they're the exact frequency of a substance. So I have in my remedies some homeopathic sarcodes, which are healthy organ tissues from bovine animals, which are from New Zealand. It's very important when you're using animal, even sources from homeopathy, that the animals, that you use it before mad cow disease existed, because you can order them from a specific time and date. No-sodes are what you use a lot of for dental healing from Stauffen Pharma, and I have my resource and my contact information at the end of the presentation. So it's made from disease. That's what we want. And dental remedies from Stauffen are no-sodes. The remedy that corresponds to the totality of symptoms is a similium. It is the most similar remedy corresponding to a case, one covering the true totality of symptoms, and when found is always curative. And in incurable cases, it is the best possible palliative remedy. I have helped people with the most critical situations, mostly with homeopathy, very seldom with herbs, except for detoxing liver, gallbladder, kidneys. Homeopathic remedies are ineffective should they be combined in a formula with herbs, hormones, vitamins, minerals, chemicals, fragrance, coloring, or essential oils. For that matter, you don't want to inject the tooth with Procaine and then inject a homeopathic remedy right next to it or over it at the same time. You want a space of time. 15, 20 minutes.
Rao would disagree with that, and he would have that protein in his homeopathic chemotherapy injection.
Yeah, I don't agree with that. So substances that can that's fine, But I spent so much time on. My German teachers are really strict. They're very, very. There's either allopathic or there's homeopathic. Vitamins are allopathic. They consider vitamins and herbs allopathic. So it's. My perspective is a very European perspective.
Rao does get great results, however, combining mistletoe with thymus, with homeopathics, with isopathics, all in the same injection against cancer. So you got to give them credit.
Right. No, I'm just saying that when you're giving someone an injection of Procaine mixed with a homeopathic remedy, the Procaine will have an effect by itself. The homeopathic remedy will not go deeply where it needs to go, because the body's attention will be on that allopathic thing, that drug that's given with it. So you can use mistletoe Iscador in a homeopathic way. You can get homeopathic thymus. You can do it all homeopathic. Homeopathic healing does, for hormones.
2 minutes.
Thank you. And we started a few minutes late. We're still all over. Okay. Okay.
People are going to leave for their planes.
Okay. All right. Okay. So, NuFem does not replace hormones like synthetic and so-called bioidentical hormones. There's no toxic side effects, etc. And for women, we want to and men, we want to target women, the hypothalamus, pituitary, adrenals, ovaries, uterus, vaginal health. And men, we go for we use the hypothalamus, pituitary, adrenals, testes, prostate. So it works on many things, including children with growth hormones, teenagers with hormonal problems going through puberty, and men with low testosterone, low libido problems. Liposome cream is very important. It penetrates in right to the bloodstream. And these are the ingredients, which if you don't have them, we can get them to you. Oh, they're in your brochure, all the ingredients. So let me just see if there's anything else. These are what the ingredients do if you chose to use them individually instead of my formulas, which is always a possibility. Okay, and I think we're just about to the very end. There was just the resources I want to get to for you, because it's very hard to find them. Specifically the Staufen. Yeah. So Staufen Pharma, there's the phone number, fax number, and the email. If you email them, you will get a response back pretty quickly. Now, before there was a problem, but now they're responding. And there's my information as well. Thank you very much.
Let's go back. We can say that again.
Okay.
Just keep it sitting there.
Oh, just keep it sitting there? Okay. Yes?
Theresa, I disagree with your interpretation of the saliva test when someone using a cream. When somebody's using a cream for saliva and uses saliva test, you have to understand that saliva is an excretory fluid. You're actually looking at the excretion of what your body hasn't taken in if you do a saliva test while somebody is on that. I also think when you use saliva, you have 6 points for cortisol. You should also be doing 6 points for each and every hormone and do an average. Get a better look at the
Thank you. So basically, after doing 1,000 people before and after, what we have to look at is not only statistics, but we also have to see how the patient's feeling. And my doctors tell me, and the patients tell me, that this is fantastic for them. So this is what we need to do is move forward. I want to thank you very much.
Can we just get everyone to stick around a little bit?
One, before we take over, let's thank the speaker here properly. Yeah, Theresa has been one of the great minds in this country. And just wanted to say something with the hormone discovery, because I got some of my own experience I like to share. For the last 6 or 7 years, we've also been using homeopathics to balance the hormones. And it really has been astounding. And maybe just to give you the last bit, we have our own line of products that the pharmacist makes somewhere, but the simple principle is, if you give a hormone homeopathically in a high potency, it will down-regulate that hormone in the body. And if you give it in a low potency, it will upregulate it. So there's a very simple principle inherent in this that's been fantastic. And our experience now, I'm not as experienced in naturopathy as Theresa is, but in our experience is what we do is, like, for about a year, we try to balance the hormones homeopathically. And what we come up with, if anybody still needs a hormone, bioidentical hormones, from a pharmacy, it will be much, much lesser amount. And instead of giving 3-4 hormones, it will only be 1. So that maybe the man, who is 60 years old or 70 may need a tiny bit of real testosterone after we balance the hormones homeopathically for optimum benefits. And I also agree with Carol that the saliva test is not as good as people think it is. It can sometimes be very misleading. We've had some cases where they had astronomical levels of something in the saliva, and then we check in the blood, and they're actually deficient of it. So I think the saliva test is not in every case like the best test. And I know that Theresa really uses muscle testing to double check things, and the muscle testing or EAV testing is really like the better guide. But I think the saliva hormone testing puts a lot of oomph behind it. It shows the patient there is a problem and in which direction it goes. And so I totally agree with your approach, but I also think we shouldn't throw away the allopathic approach totally. There should be a staging. You know, this should be always first, that we try to balance things naturally, take it as far as we can, and then take another look, and there may be still a room for the other.
Well, I have to just say that I found blood testing to be very insensitive to seeing the hormones, and what if a person is on HRT, like estrogen, it'll take a long time to show up what it is in the blood. It'll take a longer time. So I found it to be very insensitive. And I have found the way that I have designed this saliva test for it to be extremely sensitive. But more importantly than all of the head stuff is, how does it work? How does the patient feel? And what kind of results do they get? That's the end result. So from that perspective, and from the 1,000 people is a lot of people. It's a lot of women, and so it's good to look at all different approaches.
Maybe I say one more last thing. One thing I'm very grateful to you for is for your dentists to know that every dental intervention you do messes with the hormones, and there's actually thousands of naturopaths and MDs in this country being busy balancing out what the dentist has done, and it keeps all of us busy. And what we want to find is a good compromise. Sometimes it is better, in my opinion, to leave a root canal tooth in if it's needed for the statics, so to give the patient a bite and ability to chew, and use 1,000 other things to balance the damaging effect on that. I think we're at a stage now where we can actually do that, where we can actually use our biochemical knowledge and our hormone knowledge and our homeopathic knowledge to balance the effect of a tooth that's not optimal, and or a bunch of dental materials that may be not compatible with the patient, but we can do now certain things to move the patient in the direction to tolerating the dental materials better, and to antidote permanently like the things that the tooth may be doing. And I think it's a new time in that way, that leaves space for everybody to exist. Yeah, I think. Okay, let's take that as a last comment, because I know we need to go on the break.
Saliva test, dentists, with all these new filling materials which have estrogen mimicking factors. Okay?
Well, let me cut that off right there. Yeah, there was a study, the Richardson report from Canada, that showed that if you have every tooth in the mouth filled with plastic, the amount of estrogenic compounds given off is about 1,000th of that what you take daily in with your normal nutrition. If you have on a good nutrition, you take in 1,000 to 2,000 times as many estrogenic compounds as come out of the teeth if you have every tooth in the mouth filled. I think that's important. There's no doubt the estrogenic compounds that come out, they have an effect, but the quantity matters also in relationship. So we want to keep sane with all this. What was the? If it affects the saliva test, it should not, because it's quite specific.
You mean all of the substances? Yeah, it shouldn't. But I'll tell you, when you send your saliva test in through the mail, and if they're irradiating the mail, like if it's coming from the East Coast, then it will destroy the proteins. So whenever the patient sends, that will affect the saliva more than anything, is UPS doesn't irradiate the mail. So it's important if you're using saliva tests, and if you have patients on the East Coast where they're irradiating mail, send to UPS. But no, the dental things, composites, and shouldn't make a difference.
What does make a difference is that amalgam fillings totally wreck your saliva-producing glands, and the saliva no longer is reflective of your general health. So we found that out, that when the sphenopalatine ganglion and the submandibular ganglion, those structures that actually are responsible for the saliva flow, if they're sick themselves, the saliva no longer reflects what's in the body. That is not commonly known yet, but will be known sometime soon. Yeah, but the saliva is still, it's the only practical test we have right now. Let's face it, it's the only thing we have right now. It's the best tool
amongst the tools that we have, and we have to use it. I have 24-hour urine samples that were completely out to lunch in terms of what was in there, had no relationship to the patient's true blood levels. And so there is a pro and con to everything. Let's do this sort of in private circle. And I know there's different opinions. We want to also honor the previous speaker, and just let the opinions kind of settle. There's one more most important issue. I was asked several times during this course. This is a personal thing. I shouldn't do this here, but I do. There's still some people in this room who have not taken the neural therapy, the basic neural therapy workshop. It is coming up in about 3 weeks in Seattle. And those of you who haven't taken it, you have to take that workshop. It's a must as an entry point. It's a ritual everybody has to go through who wants to kind of advance in alternative medicine. So it's in Seattle in 3 weeks. And here's Vaughn with an announcement.
We're going to make this short, but I wanted to make we have a very illustrious member of our academy, and I want to honor him. He came in. I invited him in today. Dr. Chester Yokoyama, dentist, is the first mercury-free dentist to be appointed by a Republican or Democrat. This was Governor Gray Davis, who came to our assistance and help through the help of the ABD members, also IMT, and also the Holistic Dental Association got together and was able to go ahead and do a fundraiser and meet with Gray Davis. And he appointed Dr. Chester Yokoyama, who is a member of ABD, to be I consider to be the opening door for the change of mercury-free dentistry. Chet is a mercury-free dentist practicing in Los Angeles. His dad's a dentist, and he is probably one of the most sincere and most idealistic and one of the most pure-hearted souls to actually be on this board. And one of the things is I'm going to let him speak a little bit, but he'll be here for the panel. And as representing the governor and also the state of California, I'd like to introduce Dr. Chester Yokoyama.
Thank you, Vaughn. Thank you very much. First of all, I have to say I was asked by Vaughn to come up here, and he said, well, can you say a few words? And I said, yeah. But I have to make the disclaimer that I don't represent the governor today, and I don't represent the board, because they specifically brought in a proposal and passed it that all speaking engagements or all speaking at any function, if you are a board member, has to be passed through the president of the board. So I haven't talked to the president of the board about this because you told me about this the day before yesterday. So I can't say anything about the board. I can only I can answer questions, and I can talk about the amalgam issue. And as a member of American Academy of Biological Dentistry, I can address you and just come up here and say a few words. First of all, Vaughn is right, and I need to thank many of you in the room who contributed or gave money to the cause of bringing someone like myself into the board. The dental board, as you know, is influential in changing and bringing about the legislative and really the good changes that we really need to make, but there's nobody on the board representing a group like yourself, and really nobody on the board in an alternative, complementary, biological, holistic way. So there is one other dentist in Minnesota who is mercury-free, and he was really the first. I am the first in California. So I'd like to thank all of you. It's wonderful to be in front of a friendly group, because I've been addressing not so friendly groups. I'll say I thank you for backing in a financial way, in a psychological way, in many ways, backing my work at the board. I was going to talk about what has been happening, but I'll just tell you real quickly that many issues that have been in the way of mercury-free dentists are dissolving, and the lawsuits that have been brought against the California Dental Association and actually dentists in California have resulted in the Prop 65 warning that probably most of you know. If you see the BioProbe letter, it was very thoroughly discussed in that. There will be a warning that basically says amalgam exposes you to mercury, an element known to the state of California to cause birth defects and reproductive harm. Well, that is a big step forward. That warning, unfortunately, is followed by a disclaimer by the California Dental Association that says that the FDA has approved all these materials for use in dentistry. Well, that sort of gets the CDA off the hook, so to speak. And the FDA, it is still questionable what they have approved and what they haven't approved and how they've approved it. So much effort is being put into to figuring out exactly what does that mean. What does the FDA approval mean? The second part of that is right after that line, they say, consult your dentist for appropriate materials, which really, I'm telling you, is a 180. I mean, before CDA said, and this is all public knowledge. I mean, I'm not telling you any secrets. I'm just giving you the facts. Before, they said very emphatically, we are the organized voice of dentistry. We are the experts on this. We have the science, and there are literally thousands of documents and literature that we can point to. Now they are saying, well, gee, actually we don't have scientists. We rely on the FDA. The FDA has approved all materials for use in dentistry, all these materials for use in dentistry. So that's sort of an easy way to get out, and I feel bad about that, actually, but I won't comment on that. We had a meeting. I'll get to the question in just a second. I just wanted to tell you that we had a meeting with Fritz Leuscheider, Boyd Haley, the person who actually wrote the dental materials fact sheet, and that was Alton Lacey. Dr. Lacey's from University of California at San Francisco, and Harold Slavkin, Dean of the USC Dental School. They came to testify in front of the board. I thought it was an excellent presentation by everyone involved. It showed, in my opinion, some major faults in the amalgam backing science. However, we have had no action from the board. So things change slowly. You can lead a horse to water, etc. I'm very encouraged, actually, because we are moving ahead in several areas that I just heard about. I think in Arizona we've had some changes, and in California things are changing, but slowly. So you had a question.
Quick question. I think they said that warning had to be posted in offices of so many employees. What was it?
9 or more employees, but I believe because it's a global settlement, it was a settlement made out of court, I believe, that they will have to send it out to all members of CDA and any member of the general dentistry public who would like to be involved. However, I saw a figure of $635 or something like that to be involved in this in this settlement, which actually is a settlement. It's a settlement to protect dentists from being sued, and this is kind of strange to me, and I don't understand it exactly. But there is a settlement. It will give the Prop 65 warning. It will go out sometime in March, which is right now. It should be going out before March 9th. There are some things on the horizon. I am the chairman of the committee to write a consumer-friendly California dental fact sheet. And anyone who practices in California knows that you are responsible now for handing out a fact sheet. Fact sheet, of course, is barely decipherable by well-trained dentists. So it is not consumer-friendly. I am in the process of changing that. There is a great consumer-friendly fact sheet from the state of Maine, which seems to be working out very well, and hopefully we can move in that direction. But we don't know. Andy?
I think Chet is really downplaying his role in all of this, and I was at that meeting the scientific meeting he put together, and with Haley and Lorschneider, the other two individuals that were there were really jealous as far as their defense of the novel, producing the novel. But I just wanted to say that the job that Chet did in putting that together was just incredible. He deserves an amazing hand. But also, Ron put together the meeting with the governor that enabled us to get Chet on board. I wanted to give special attention to Ron as well.
Sometimes it helps to have friends in high places. It's not what you know, it's who you know.
I know everybody's anxious to get going, so
Yes.
thank
Jen
you.
will be available for questions on also the panel meeting also, right? You will be here?
I'll be here.
Okay, so hold your questions for them so we can take a little break.
Thank you.
Thanks.